Introduction and summary of the case study. I am Bonnie, the diabetes educator. This presentation focuses on pregnant women with GDM. However, the education plan is specific to Sally, a 32-year-old first-time mother diagnosed with GDM at 20 weeks gestation. Since this is a new diagnosis, Sally lacks knowledge of the condition, risk factors, and management strategies. Because Sally has maintained a healthy lifestyle, she is not aware that this is not a diagnostic criteria for GDM. Oral glucose tolerance test is the criteria, and her results are indicative of GDM, which is carbohydrate intolerance with onset during the current pregnancy. Sally needs detailed information and appropriate education on the key GDM issues that includes pathophysiology, self-management, which involves lifestyle modification, possible complications, as well as pharmacological treatment options. The critical issue involves teaching Sally self-monitoring and tracking of BGL. Pathophysiology in normal pregnancy and GDM. For Sally to understand her condition, she will be educated on the pathophysiology of pregnancy and GDM. She needs to be aware that GDM is a pregnancy complication where BGL is elevated due to fetal and maternal hormones that cause insulin resistance. Any pregnant woman is at risk despite their healthy lifestyle. In normal pregnancy, glucose readily crosses the placenta while insulin doesn't. Insulin resistance happens due to normal hormonal changes that partially obstruct insulin effects. Due to insulin resistance, glucose is shunted to the fetus to facilitate growth and development. In GDM, however, increased insulin resistance results in BGL rise to 80% of normal pregnancy. Increased insulin resistance results in decreased insulin secretion, which leads to increased maternal glucose, causing GDM diagnosis. At high levels, glucose can cause fetal and maternal complications. What is important is for Sally to know that GDM resolves after pregnancy. Stress management and psychological support. The stress of pregnancy itself, worsened by GDM, can cause serious maternal and fetal health problems. Sally will learn how to cope with stress. Reducing the effects of stress is important for the health of both herself and her unborn baby. The education plan will therefore encompass assessing Sally's feelings regarding the new diagnosis and whether she has adequate support systems at home. Depending on the assessment results, with her consent, the educator will make referrals as appropriate, for example, social worker or mental health services, to provide ongoing individualized care. Sally will be educated on coping mechanisms such as deep breathing exercises, meditation, yoga, etc. The educator will also promote behavior change strategies such as self-monitoring, goal setting, and problem solving. Sally will be encouraged to join a social group or engage in activities she finds enjoyable to reduce her stress levels and hence her complications. Nutrition therapy. The primary intervention for GDM is to modify diet and physical activity. The education plan will include a discussion on culturally appropriate dietary requirements and the use of a food diary for an individualized eating and food tracking plan. Sally will be encouraged to make optimal food choices using the 5 food groups to maintain optimal maternal and fetal health that promotes appropriate BGL targets, ketone absence, and proper maternal weight gain. The diet should also include low GI foods to avoid saturated and processed foods, at least 175 grams daily carbohydrates, plenty of water, and small meals spread throughout the day. A dialogue on the following will be included during the education session: dietitian input, the influence of carbohydrate and low glycemic index foods on BGL, portion sizes, and label reading. Exercise and physical activity. Keeping active and following a healthy diet makes up a key part of managing GDM. Regular, moderate physical activity has been shown to be an effective tool in managing BGL, which may prevent, reduce, or delay the need for medication. It also improves heart health, prevents excess weight gain, and reduces blood pressure and stress levels. The plan will include assessing Sally's current activity levels and educating her on how physical activity increases insulin sensitivity by counteracting hormonal changes and also increases BGL uptake in skeletal muscle and decreases insulin needs in GDM. As the pregnancy progresses, Sally will be advised to consider exercise snacking, such as 10 to 15 minutes periods of low to moderate intensity exercise. She will be advised to avoid contact sports and strength exercises. Recommended aerobic exercises of at least 150 minutes per week will include the following exercises as listed in this slide. Short and long-term health implications. Interventions that include adopting a low glycemic index diet and increasing levels of activity have been successful at reducing maternal BGL and reducing insulin requirements during pregnancy. Reducing maternal blood glucose levels in turn is associated with a reduction of macrosomia and maternal weight gain, which are the two most important factors in reducing serious complications. Sally will be educated on the potential GDM maternal, fetal, and baby health implications. Listed below are short and long-term maternal risks and health implications that Sally needs to be aware of to encourage her to take charge of her health. This slide includes a list of fetal and baby health implications and risk factors for Sally's awareness. Pharmacological treatment options. If BGL is not adequately controlled with lifestyle changes, decisions to commence pharmacological treatment based on Sally's preference, degree and hyperglycemia patterns, fetal growth, and gestational age will be made. Sally will be advised that even though insulin is regarded as a treatment choice, metformin is considered safe to use. However, because metformin crosses the placenta to the fetus, it is only recommended as first-line therapy for those unable to use insulin. To help her make an informed treatment choice, Sally needs to be aware that although there is sufficient data indicating that administration of metformin is safe and effective in GDM, there is very limited data concerning the long-term effects of metformin on the offspring. Below is information on metformin versus insulin that Sally needs to be aware of when deciding on pharmacological treatment options. Critical issue justification. BGL self-monitoring and tracking has been identified as a critical issue for Sally because it is a crucial measurement of how well GDM is being managed to reduce the complication risk. BGL record keeping will help Sally know immediately if her levels were in her target range. This will help her make decisions that will influence BGL levels within her target range. To achieve accurate record keeping and BGL management, it is important for Sally to master the use of the BGL meter and the lensing technique. With self-monitoring, Sally will identify if her diabetes treatment regime was helping her to achieve her target levels or not and to take appropriate action. She will better understand how activity, food, and stress influence her BGL. She will also learn about BGL patterns throughout the day and night, e.g., patterns of hypoglycemia if she is commenced on insulin or other blood glucose lowering medications, and how to manage the symptoms. Record keeping will help her build confidence in GDM self management. She will know when to seek support from diabetes health professionals or her GP to adjust her treatment regime or simply to seek advice on lifestyle modification as required. The individualized education plan will include implementation of a systematic process that will require input and active collaboration with Sally and the multidisciplinary team to include endocrinologists, diabetes educators, pharmacists, physiotherapists, psychologists, dietitians as necessary. Identification and interpretation of target values is a critical issue that will help Sally ensure that she has a healthy pregnancy and a healthy baby. She will be educated on how to identify target ranges, timings, and rationale for SMBG, among other things. Sally will also be educated on the critical BGL self-monitoring measures to include the importance of the following factors as indicated below. The education session will also incorporate meter and strips management, including the following aspects of BGL monitoring as stated below. It is critical for Sally to know the proper lensing technique to enhance BGL self-management as per the following BGL monitoring components as listed in this slide. Bringing it all together, At the end of the education session, Sally will be able to discuss the following: the importance of accurate BGL record keeping, the significance of recording daily SMBG values in a logbook with timings, the value of accurate information in relation to food intake, stress levels, and exercise. Accurate records will empower Sally and equip healthcare professionals with vital data to provide advice on lifestyle changes or need for pharmacological treatment adjustments. Conclusion: in this education plan, a summary of the case study has been deliberated on, including detailed accounts of the key and critical issues as listed below, specific to Sally's GDM self-management educational needs. Thank you. This is the end.